Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
The patient voice is critical in understanding what new devices, new treatments, new biologics are needed to treat their disease and overcome the limitations of current therapies. There are many ways that patients can participate in this process. They can help participate in designing the right endpoints. I mentioned the FDA guidance. Part of that is for patients to have the ability to say, yes, this makes sense to me, or this doesn't reflect my disease or what's important to me. Other things they can do is to read protocols to make sure that they're understandable at a patient level for patients who are participating in clinical trials. And also they can help manufacturers choose patient-relevant outcomes. So to help understand a patient's quality of life, there are instruments called a patient reported outcome survey, and they can help us understand which is most important and reflects the burden of their disease. The greatest unmet need is the scarcity of organs itself available for transplant. Another unmet need is the ability to transplant patients as soon as possible as they are in end-stage kidney disease. Earlier transplantation leads to the best possible outcomes, conveying both survival and patient quality of life benefits. In addition, there are some patients who have little to no access to transplant, even with the organs that are there. These highly sensitized patients have an immunologic barrier that makes it near impossible for them to receive a kidney transplant. And patients can become sensitized by previous transplants, pregnancy, or even blood transfusions. Even within the prioritization programs, within the kidney allocation systems, these prioritization programs are designed to increase these highly sensitive patients' ability to receive an organ offer, but some of them still will have little to no access. And without new treatments to desensitize these patients, they'll not have the ability to get a life-transforming kidney transplant. Effective and rapid desensitization can offer hope to these highly sensitized patients and provide for longer life expectancy and improved quality of life. Understanding the patient voice is increasingly important. How we as manufacturers convey value to physicians, payers, policy stakeholders, which in turn is how we make new treatments available through the regulatory and reimbursement processes. The patients and their families have the greatest insight into the severity of their disease, the burden of the unmet need, and the treatments that are required to feel better. The insights help us as manufacturers understand the benefits and risks of a new product within a real-world context, and then help us convey that to decision makers to understand the potential value for new treatments. Examples include in the US, there's a new regulatory guidance that offers the opportunity to gather patient input throughout the regulatory process. This sends signals to us as manufacturers of the importance of that and to get more and better patient involvement. Similarly, in my role in negotiating access with payers globally, the stakeholder that they are most interested in hearing from is the patient. They want to understand the impact on a patient's life that a new treatment can provide and what the burden associated with not having that treatment available for them. Hansa Biopharma is currently working to make transplantation more accessible to highly sensitized patients. Remember, these patients otherwise are unlikely to be transplanted due to their immunological barriers. Although the kidney allocation systems have priority systems in place, they still are disadvantaged and in urgent need of a more personalized and innovative approach. We've got a product called imlifidase that's currently the only approved therapy across Europe for desensitization treatment of highly sensitized adults with a positive cross-match against an available deceased donor. We're excited to hear about the early clinical experiences in providing this innovative treatment option for patients who otherwise would remain on dialysis. We're continuing to develop this product in the US, and we're currently in a phase 3 program in hopes of bringing this important therapy to patients here. We're also actively working to bring the patient voice to the forefront. We're working with patient advisory groups globally to conduct a patient preference study to understand what matters most to these highly sensitized patients when making a choice between two therapeutic options, remaining on dialysis or proceeding with a higher risk kidney transplant following a desensitization treatment. Understanding the value patients assign to these factors will help when deciding which treatment options are most critical, potentially benefiting key stakeholders, including clinicians, payers, and also potentially raising the voice can help inform other patients looking for treatment options. And the patient advisory groups can also gain insights so that they may better represent their highly sensitized end-stage kidney disease patients. Good question. The patient involvement strengthens the entire development process, hopefully, as I've demonstrated. If you think about the patient, they interact most often with their healthcare provider. And I think one key to putting the patient in the driver's seat would be to have them help change the conversation with their physician from what's the matter to what matters to me. And what matters to an individual patient is specific, and it's most often achieved by an empowered patient. That might be, someone who takes control of their own clinical journey. That can be researching clinical options yourself on the internet. It can be getting involved with social media groups with other like patients to understand their experiences and what they are choosing, and also getting involved with the patient advisory groups as well, to help them discuss options and experiences. Specific to the question of, what should they ask? For these highly sensitive patients, key questions for them to ask their healthcare provider: how can I increase my chance to access a kidney transplant? Another question could be, what are my options other than waiting on dialysis for a matched kidney offer?
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care, from prevention and diagnosis to transplantation or access to care treatments.